President Yoon vetoes another opposition-led act, this time the Nursing Act, citing too much conflict between relevant medical groups. Rival parties show starkly different reactions. Our political correspondent Han Seong-woo has the latest.
Exercising his veto power for the second time since taking office, South Korean President Yoon Seong-yeol rejected the opposition-backed Nursing Act on Tuesday, saying it could harm public health by causing chaos in the medical system.
국민 건강은 다양한 의료 전문 직역의 협업에 의해 제대로 지켜질 수 있는 것입니다. 이번 간호 법안은 이와 같은 유관 직역 간의 과도한 갈등을 불러일으키고 있습니다.
The proposed law aims to improve the working conditions of nurses by outlining the roles and duties of licensed nurses separately from the current Medical Service Act, which puts them under the guidance of physicians. But it's a contentious bill that has pit South Korea's nurses against its doctors, who fear it will lead to confusion in the public health system if nurses can open their own clinics. Nursing assistants, meanwhile, have claimed it would discriminate against them while privileging nurses. Over at the National Assembly, the ruling People Power Party welcomed President Yoon's veto, saying the bill threatened to destroy the country's medical infrastructure.
It was inevitable and perfectly natural for President Yoon to veto this bill. It would divide South Korea's medical community and put its public health system at risk of collapse.
The Democratic Party of Korea, on the other hand, claimed the president, in vetoing the bill, broke with one of his election pledges, an allegation an official at the presidential office denies.
His inability to fulfill an election pledge demonstrates his incompetence, and he has shown contempt for the legislative power of the National Assembly.
That view was echoed by the head of the Korean Nurses Association, who warned that the country's nurses would engage in collective action against the veto.
We are declaring the launch of a movement under a 2023 general election planning team to convict and remove from office politicians and bureaucrats who are unfair and lack common sense.
In a briefing later in the day, Health Minister Cho Kyu-hong vowed to reduce the excessive workloads of South Korea's nurses through a government plan announced last month. Yoon's veto means the Nursing Act will be sent back to Parliament. For his veto to be overridden, however, the bill must win 2/3 approval in a vote taken by a majority of the National Assembly's lawmakers, making its enactment unlikely. Han Seong-woo, Arirang News.